syndrome and me. Standard therapies. Treatment. The treatment of Gitelman syndrome is directed toward the specific symptoms that are apparent in each individual. Treatment may require the coordinated efforts of a team of specialists, pediatricians or general internists, kidney specialists, nephrologists or pediatric nephrologists, cardiologists, social workers and other healthcare professionals may need to systematically and comprehensively plan individuals' treatment. Genetic counseling may be of benefit for affected individuals and their families. Because this is a rare disease, even well-trained private practice or academic nephrologists may have little experience diagnosing or treating this disease. There is no cure for Gitelman syndrome. The mainstay of treatment for affected individuals is a high-salt diet with oral potassium and magnesium supplements. Potassium-rich foods such as dried fruit are helpful. Magnesium supplements in single large doses cause diarrhea and should be avoided. Magnesium supplements should be taken in small frequent, 4 to 6 times/day, in order to avoid magnesium-associated diarrhea which may worsen hypokalemia and symptoms of volume depletion. For many individuals, lifelong daily supplementation with magnesium is recommended. In some cases, during severe muscle cramps, magnesium has been given intravenously. In general, the goal of therapy should always be the attenuation of symptoms rather than the normalization of electrolyte abnormalities. Because of the risk of infection and thrombosis, central catheters should be discouraged. Some affected individuals may receive medications known as potassium-sparing diuretics such as spironolactone, eplerenone, or amiloride. These drugs are mild diuretics that spare potassium excretion. While these agents improve hypokalemia, they rarely normalize serum potassium concentrations. The goal of therapy is to improve symptoms, not to normalize laboratory abnormalities. Individuals with a prolonged QT interval should avoid drugs that prolong the QT interval. For a list of such drugs, contact the Sudden Arrhythmia Death Syndromes Foundation. Finally, the initial report of 2 patients with Gitelman syndrome by Hillel Gitelman and Associates at the University of North Carolina at Chapel Hill in 1966 opened the door to understanding the role of the kidney's handling of salt, not only rare genetic diseases but more importantly in high blood pressure, which affects millions of people worldwide. Dr. Gitelman showed that a well-studied orphan disease can open our eyes to more widespread health issues. http://www.sads.org/investigational therapies. Information on current clinical trials is posted on the internet at www.clinicaltrials.gov. All studies receiving U.S. government funding, and some supported by private industry, are posted on this government website.
Thank you for watching and listening. This may be your first experience with a patient of such strange and unbelievable medical measurements from a human body. Think and know that this is not your normal patient. Please ask questions. The main goal as said in this video is for the diagnosed Gitelman syndrome patient's comfort and ease. The pain these patients experience is nothing less of deep lacerations, sudden impacts, burning sensations, and being stabbed by 1 million needles all over your body that blood flows through.